If you've ever wondered why doctors and nurses wear compression socks during their long shifts, you're about to find out. I'm Dr. Andrew Schneider, a podiatrist in Houston, Texas, and today I'm going to reveal the truth about compression socks, benefits that most doctors aren't telling you about, and mistakes that can be costing you both money and comfort. In my practice, I see many patients who could benefit from compression socks, but either aren't wearing them or are wearing them incorrectly. By the end of this video, you'll know exactly how compression socks can help you, who needs them most, and how to get the maximum benefit without wasting money. Let me start by explaining how compression socks actually work. Think of your circulatory system like a two-way highway. Arteries carry blood from your heart down to your toes, and veins bring them back up. The problem is, those veins are fighting gravity all day long. Compression socks act like an external support system, helping to push that blood back up towards your heart. But here's what most people don't realize. Not all compression is created equal. Before I share the 5 major benefits, take a second to hit that like button if you've ever experienced tired, achy legs, and comment below with your experience with compression socks. Let's dive deep into the science-backed benefits of wearing compression socks. Benefit 1. Reduce swelling and edema. This isn't just about comfort, it's about preventing long-term tissue damage. When fluid accumulates in your lower legs, it stretches the tissue and can lead to permanent changes in your skin and blood vessels. Compression socks work by creating a pressure gradient that actively moves fluid upwards. The graduated compression is strongest at the ankle and decreases as it goes up the leg, creating a natural pumping action with every step you take. Benefit 2. Enhanced circulation. The improved blood flow from compression socks doesn't just reduce swelling, it increases oxygen delivery to your tissues. This enhanced circulation helps to remove metabolic waste products more efficiently, reducing muscle fatigue and soreness. For people with diabetes or peripheral arterial disease, this improved circulation can be particularly crucial for maintaining tissue health and preventing complications. Benefit number 3, blood clot prevention. Deep vein thrombosis, or DVT, is a serious condition where blood clots form in the deep veins of your legs. Compression socks help prevent this by maintaining consistent blood flow and preventing blood from pooling in your lower legs. The graduated compression creates a gentle squeezing action that helps maintain proper blood velocity throughout your veins, significantly reducing your risk of blood clots. Benefit number 4, athletic performance and recovery. The science behind compression socks in athletics is fascinating. During exercise, they help reduce muscle oscillation and vibration, which can lead to reduced muscle fatigue. Post-exercise, they help clear lactic acid and other metabolic waste products more efficiently. The compression also helps to reduce exercise-induced muscle damage by supporting better blood flow during and after activity. Benefit number 5, venous disease prevention. Chronic venous insufficiency and varicose veins develop when your veins stretch and lose their ability to push blood effectively back to your heart. Compression socks provide external support to your veins, helping to maintain the proper shape and function. This support helps prevent the progression of venous disease and can delay or prevent the development of varicose veins. Now let's bust some common myths about compression socks. Myth number 1, stronger compression is always better. The truth? Higher compression levels can actually be harmful if not properly prescribed. More isn't always better. Proper fit and consistent wear are more important than compression strength. Myth number 2, compression socks are only for older people or those with medical conditions. The truth? They're beneficial for anyone who sits or stands for long periods, regardless of your age or health status. Myth number 3, you should wear them 24/7. The truth? Most people should remove compression socks at night to allow their skin to breathe and recover. Myth number 4. All compression socks are basically the same. The truth, there are significant differences in compression levels, materials, and gradient pressure that make certain types more appropriate for specific needs. Myth number 5. They're only necessary when you're already having problems. The truth, compression socks are excellent preventative tools, often more effective at preventing issues than treating existing ones. Here are the warning signs that your compression socks aren't working properly. Numbness or tingling in your toes, skin irritation or redness, increased pain or discomfort, color changes in your feet, bands or marks in your skin, and if you experience any of these, remove your socks immediately and reassess the compression that you're using. Here's my professional guide for choosing the right compression levels. 8 to 15 millimeters of mercury is perfect for everyday wear and mild swelling. 15 to 20 millimeters of mercury, ideal for most people, including nurses and teachers. 20 to 30 millimeters of mercury for significant swelling or varicose veins. 30 to 40 milligrams of mercury only with a doctor's prescription. For proper fit, measure your legs at the ankle, the smallest point, at the calf, the largest point, from the floor to the knee. And do this first thing in the morning for best results. That's before your foot swells at all. Before I share my number 1 tip for maximum benefit, take a moment to subscribe and hit that notification bell. Here's that top tip. Consistency is more important than compression level. Wearing 15 to 20 millimeters mercury socks regularly is more beneficial than wearing a stronger compression occasionally. If you found this information helpful, you'll love my video on swollen ankles and feet. I'll link to it right in the description. And if you're in the Houston area and are struggling with circulation issues, click the link in the description to schedule a consultation. Thanks for watching, and remember, your feet carry you through life, so take care of them. I'm Dr. Andrew Schneider, and I'll see you in the next video.